Hi, this is Dr. Ludwig Lin for the Society of Critical Care Medicine. Today, I'm honored to be able to speak with Professor Jason Satterfield, PhD, Professor of Medicine and Academy Endowed Chair for Innovation in Teaching in the Division of General Internal Medicine at the University of California, San Francisco. Dr. Satterfield is an expert in the areas of medical education and behavioral health, as well as physician and trainee well-being, with active funded research in digital health, tobacco cessation, and opioid use disorders. He is also the author and speaker in a popular online series of video and audiobooks on cognitive behavioral therapy and behavioral health. We are here today to discuss the highly relevant topic of self-care for the healthcare worker in these times of COVID-19. It's a very stressful period in all of our lives, and any tools and I think any insight that we can get into this would be very helpful. So welcome, Professor Satterfield. First of all, do you have any conflicts to declare for us?
I do not. Just let me say it's a pleasure to be here. I appreciate the invitation.
Oh, we are so grateful that you have the time to speak with us today. The first thing that I wanted to ask you, sort of as a way to start our conversation, is you work at UCSF, one of the top medical centers, and they're very busy preparing for the surge on the West Coast. What are some of the big issues that you've heard from your colleagues at the front lines of clinical care?
Sure. And let me say that I work in adult primary care, mostly in an ambulatory setting, but also do work a lot with hospitalists as well. So very much have regular connection with those frontline workers, not just physicians, but also nurses, respiratory therapists, social workers, psychologists, behavioral health providers. So really want to speak to the whole group of folks that might be out there on the front lines. I think, like in most parts of the country, there's a lot of anxiety, there's a lot of worry, there's also a lot of determination, and there's a lot of eagerness to be as prepared as we possibly can be. One of the things that I've heard often, though, is there is this perception, an understandable one, but I think a misperception that we have to be superheroes, right? That we are not allowed to experience stress or anxiety or sadness or loss or fear in the same way that non-healthcare workers or non-frontline providers are allowed to experience it. And let me first say that, as we know, we're all human. And even though we've developed probably some pretty robust skills at suppressing our emotions to get through difficult professional challenges, those emotions are still there. Those challenges are still there. They might be on a shelf, but eventually they're going to manifest in different ways. And some of those ways include sort of emotions that we might be feeling, like anxiety or fear, depression, even irritability or emotional lability. Might be cognitive symptoms. So there's a lot of, I think, worry and a lot of rumination and maybe some tunnel vision of focusing a little too much on the news or the statistics or reading various different newspapers to try to stay abreast of what's happening. There may be physical or medical symptoms. I've heard a lot of folks talking about intermittent insomnia, changes in energy level, appetite, weight gain, weight loss, as a consequence of the worries that they have. And then some just behavioral strategies, some of which might be healthy and helping us to cope, and some maybe not quite so healthy. But all of those are happening for all of us, and it's okay, but it's important to acknowledge them so that we can do something about it.
Thank you for saying that. I do think it's really hard for medical personnel to feel like they are not superhuman. I think we're trained to be that way. We're trained to be tough. We're trained to show up every day. And so, thank you for sort of validating those feelings. Is there a optimal way of approaching this? I mean, I guess all of us are different. So maybe you could talk about a couple of different archetypal personalities and how we could potentially work our way through this.
Sure. And I think it is important to remember that we're all unique individuals and have our own ways of coping. We have strategies that are adaptive and maybe strategies that are maladaptive. So it's important to know sort of what tools you have in your toolbox, and maybe later we'll talk about which tools you might want to add if they're not already there. It's been helpful for me and for some of the residents and fellows that I work with to take a step back and look at some of the foundational psychological theories about stress and coping. In a way, it helps us to understand the etiology of stress or the causes of stress. If we understand what's causing it, what's driving it, what's amplifying it, it helps us to better understand the types of strategies that might mitigate it. Or it's not going to go away, it's not going to be zero, and I don't think we want it to be zero, but at least get it down to a manageable level. So really the theory that first comes to mind is one that was developed at UC Berkeley and also at UC San Francisco, and this was Dick Lazarus and Susan Folkman's work, where they looked at the role of appraisals in the stress response. So essentially when you have a stressor, you have something like COVID, this threat that's looming on the horizon, we make two kinds of appraisals. We make a primary appraisal where we start estimating how big and how bad and how terrible is this threat that's on the horizon. If it's small, well, we don't really give it that much time or attention, but if it's big, then of course it's going to grab our attention. But there's a second appraisal, a secondary appraisal that's also essential in helping us understand who is going to have a really large stress response. The secondary appraisal has to do with our estimation of our coping resources. Both our internal resources, can I handle it? Do I have the skills? Do I have the knowledge? Do I have the energy and the time? But also our external resources. So do I have PPE? Is my health system ready or not? Is my public health system going to be able to support us in what we need to do? So primary appraisals, the stressor, secondary appraisals, both internal and external coping resources. Now in the current situation, it's a really big threat on the horizon, right? Or maybe not so far on the horizon, it's actually present and here and now. And we know that even though we may have good personal resources, depending on where you might be practicing, you may have more or less in terms of external resources from your healthcare system. So it really, thinking of primary and secondary appraisals helps us to understand why so many of us might be feeling this really strong sort of burning feeling of stress. Now, it is important, though, that we realize that those appraisals are our best guesses. They are subjective estimations of the threat on the horizon, which may or may not be accurate, and they are subjective estimations of our ability to cope. And what often happens for people who are chronically stressed is they underestimate their own personal capacity to rise to the challenge, or they underestimate the willingness of people around them to provide support and to help them get through this difficult time. So I always tell patients, colleagues, peers, one of the most important things to do is to first take a step back, to use that sort of rational forebrain to objectively assess the primary stressor, your primary appraisal, and then to take a step back and to recall times when you successfully coped with big challenges in the past, your own internal resources, and to think about the network of people that you have around you, friends, colleagues, and peers that might be able to help you through this time. Hopefully that shrinks the stress response somewhat, but you know, it's still there and we have to roll up our sleeves and figure out what to do next.
Okay. So take a deep breath.
Deep breath.
Step back, assess, and think about your support network.
Right. The primary and secondary appraisal. So get as objective of a picture of the stressor as you can, and then take as nuanced a view and complete a view of the coping resources that you have and the social supports that you might have.